single cause of death in the 40s. That's because, of course, that women don't die, women are very healthy and do not die in their 40s.
There's a 2% chance of being diagnosed with the disease in your 40s, is that correct?
Correct. If a woman enters her 40s, by the time she leaves it at 50, the chance is almost 1 in 50 that she will be diagnosed with breast cancer.
Mammograms could extend one life for every 25 women screened.
That number, of course, is founded on the best studies, the largest and best studies, 8 of them, that were begun between 1963 and 1981. And those studies are necessary because breast cancer is such a variable disease. It can take, there's breast cancers that occur and are aggressive, and women may die early of the disease, but there's also breast cancers that may eventually cause the death of a patient after 10 years. Now remember, the majority of women all do fine from breast cancer, but of the deaths from breast cancer, it's variable. So these studies are very lengthy. That statistic, of course, is founded upon the best studies, which are old studies, as necessitated by this kind of disease.
So what you're saying is a woman could be diagnosed with breast cancer in her 40s, but not succumb to the disease till much later, correct?
Correct.
All right, in some instances.
And that's why these studies need to be so lengthy for true hard evidence about the final important measurement, which is breast cancer deaths.
Let's talk about this NIH panel. Who was it made up of?
Well, the NIH panel, 13 members, was composed of people with hopefully no preconceived idea of screening mammography. It was composed of lay people, scientists from other disciplines, and perhaps only 4 doctors who actually treat women. And the idea, of course, was to examine the evidence without preconceived notions.
Right, people who didn't have an agenda, because as you well know, this has been highly controversial for the past 3 or 4 years, ever since the National Cancer Institute said they weren't necessary for women in their 40s. What kind of studies did you all analyze in general, and how did you go about looking at these studies?
Well, before the meeting, we received, of course, more than 100 studies of all sorts. As I was mentioning, the best studies are the ones that I was describing, but all kinds of other evidence, I suppose, in studies, more than 1,500 pages of material, scientific material. Then we had very up-to-date reports from 32 speakers over 2 days, very arduous meetings. Then we convened in a cloistered area, and it was very difficult, very lengthy, describing the process that went on in terms of picking words to describe the benefit and risk.
The panel concluded that at the present time, all available data do not warrant a single recommendation for mammography for all women in their 40s. Each woman must decide for herself.
Correct.
You disagree with the overall conclusion of the panel, is that accurate?
Well, I agree that women should decide for themselves in their 40s, because the evidence from these long-term studies are in. On the other hand, that there is a reduction, albeit small, in breast cancer deaths in the long term. But on the other hand, there are risks obviously associated with this kind of test and any screening test.
Very quickly, I'm going to go through the benefits and the risks. The benefits of getting a mammogram in your 40s include reduction in deaths, as you mentioned, less severe treatment. In other words, early diagnosis prevents one from, say, having a radical mastectomy if you can deal with something early on. The reassurance factor, and it picks up non-invasive cancer. The risks are false positives, false negatives, radiation, and it picks up non-invasive cancer. How can that be a benefit and a risk?
See, the issue actually is very complicated. Perhaps it could be the most complicated health issue that women in their 40s face. Non-invasive cancers, which are currently being picked up on mammography, is both a benefit and a risk, because picking up early disease is valuable in terms of preventing further breast cancers. On the other hand, it's possible that picking up the non-invasive cancers is a risk, because with this new influx of women with such early diseases, it's not clear across medicine what is exactly the appropriate treatment for every subgroup and subclassification. Screening mammography has caused a large numbers of women that weren't present in the 1970s and 1980s with such early disease, and their exact treatment is controversial.
Bottom line here, what would you recommend for your patients in terms of mammograms in their 40s?
Well, my personal recommendation, as I say, I was part of the consensus panel and did agree to exactly the wording, but my personal recommendation is that annual mammography is beneficial in the 40s, and it should be started in the 40s.
All right. I'm still confused, but we appreciate your trying to clear things up, Dr. Jean Petrek. Thanks so much. I appreciate your being here. Up next, what's best?